Good afternoon, folks. I have discussion B for you. Now we're discussing, does an older adult in your life need help? Is a practical guide that explains how to recognize when an older person may be struggling, what specific signs to look for, and what steps you can take to offer support while respecting their independence and dignity. The page emphasizes observation, direct but sensitive communication, and using appropriate resources when needed. Key signs that someone may need help, extra help. Changes at home, clutter, spoiled food, unpaid bills, or unsafe living conditions can signal difficulty managing daily tasks. Problems with personal care, poor hygiene, weight loss, or neglected grooming may indicate trouble with bathing, dressing, or shopping. Mobility and falls, stumbling, bruises, or fear of falling. Suggest physical decline or unsafe home setup. Cognitive changes, repeated questions, getting lost, confusion about money or appointments can point to memory problems or early dementia. Mood and social withdrawal, depression, isolation, or sudden changes in personality are important warning signs. Medication and health management issues, missed doses, multiple prescriptions, unmanaged or skipped medical appointments. How to assess and approach the situation. Observe over time rather than reacting to a single incident. Look for patterns. Ask directly and respectfully in person when possible. Phone, email, or texts can miss important cues. Use open, non-judgmental language and focus on safety and quality of life. Involve others, family members, close friends, or trusted neighbors can provide additional perspective and support. Immediate steps if you're concerned. Address urgent safety risks first. Falls, inability to manage medications, severe weight loss, or signs of abuse. Offer practical help, such as arranging medical checkup, helping with groceries, or coordinating transportation, consider professional assessments, primary care providers, geriatric specialists, social workers, or home health evaluations can clarify needs and options, long-term care options and decisions. Home modifications and in-home help, grab bars, ramps, home aids can preserve independence. Community resources, meal programs, transportation services, and senior centers reduce isolation and support daily living. When assisted living or higher care is appropriate, look for persistent inability to manage daily needs, frequent hospitalizations, or safety concerns. Transitioning is a step-by-step decision that balances safety, cost, and the person's wishes. Conversation tips and next steps. Lead with concern, not control. I'm worried about you. It is better than you can't live alone. Be specific about what you've noticed. Examples of missed bills, falls, or missed meds, and offer concrete help. Plan together. Discuss short-term fixes and long-term plans. Involve the older adult in decisions. And document important information, doctors, meds, legal papers. Okay, guys, give me 1 second here. Okay, this next section, 10 signs that an older adult may need help. The phrase usually introduces a checklist of observational changes that suggest an older person is struggling to manage daily life safely and independently. The list is meant to help family, friends, and caregivers spot problems early so they can offer support, arrange assessments, or intervene when safety is at risk. The 10 common signs and what each typically means. Changes in eating habits or weight loss may indicate difficulty shopping or cooking, loss of appetite, dental problems, depression or illness, neglected personal hygiene, trouble bathing, dressing, or grooming can signal mobility limits, cognitive decline or depression, uh, decline in home cleanliness or sanitation, difficulty with housekeeping, laundry, or managing trash, may create health and safety hazards, unpaid bills, unopened mail, or financial mistakes could reflect memory problems, executive function decline, or financial exploitation. Missed medical appointments or unmanaged medications suggest trouble with transportation, memory, or understanding treatment plans. Increased falls, bruises, or fear of falling points to a mobility issue. Okay, folks? Balance, vision, or home safety issues that raise immediate risk. Memory lapses, confusion, or getting lost. Early signs of dementia or other cognitive impairment that affect decision making. Mood changes or social withdrawal. Isolation, anxiety, or depression that worsen with health and reduced help seeking. Changes in sleep patterns or energy levels may reflect medical conditions, medication side effects, or depression. Unusual or unsafe behaviors, e.g., leaving stove on, driving poorly, indicate impaired judgment, cognitive decline, or physical limitation. Why these signs matter. Each sign alone may not prove a problem, but patterns or multiple signs together increase the likelihood that daily functioning and safety are compromised. Early recognition lets you arrange medical evaluation, home supports, or social services before a crisis occurs. Practical next steps. Document specific observations, dates, examples, and changes over time. Talk with the older adults. Use respectful, non judgmental language and focus on safety and quality of life. Involve others, family, close friends, neighbors, or the person's primary care clinician can confirm concerns and share responsibility. Address urgent risk first: falls, severe weight loss, missed medication dosage. Or signs of abuse. Require immediate action. Arrange assessments. Primary care, geriatrician, social worker, or home health evaluation can identify medical, cognitive, or functional causes, and recommend services. Conversation tips and decision points. Lead with concern, not control. Say, I'm worried about you, and cite specific examples. Offer concrete help. Drive to appointments, help sort mail, or set up home safety check. Plan together. Discuss short-term fixes and long-term options while respecting the person's preferences. Consider safety versus independence. Weigh risk, cost, and older adults' wishes when deciding on home supports, assisted living, or more intensive care. Okay, guys, there's another reason why I did this show this afternoon, is that when you're discussing in-home care with an elderly person, you can't just make decisions for them. Now, if they can't communicate at all, then you can. But if they can still hold a conversation with you, voice their wishes, you have to involve them in your decision making process when it involves what their life is going to be like for the rest of it. Because they may be up in age. Yes, they may need help, but with your help, it's their decision to make. You have to involve the person who needs care to see what their preferences are. Too often I see where families have a family member who needs care. So the person comes to the facility, but the family member starts to talk for them. And it's not the family member that has to stay there. It's their clients. It's the elderly person who has to stay in a facility. So let them make the choice if they're able to, please. Involve the person that you're getting care for. Please involve them, because if you don't, it creates a more volatile situation for a person like me. When you bring your family member in, drop them off, help them set up a room, but then you drop them off. They're angry because they don't see, they may not see you for like months, weeks, but they're angry when they come in the facility, guys. So it's people like me who have to get them to trust me. First of all, you have to earn their trust. You have to get them comfortable with the facility they're at. You seriously have to involve them in the decision making. It's like when somebody has power of attorney to make decisions for someone, you still have to make them involved in their care decisions, folks. It's a personal issue, because they're the ones who have to live in it. They're the ones that have to be comfortable. So with that being said, that is discussion B for you. I'll be back on with C shortly. Give me a little bit for a break, please, and I'll be back on with you. For now, Gator Wellness, take care, folks.